BRS offers personal touch during COVID-19 challenges by Ella Hart, National Program Consultant. Everyone in our country has been through challenging and adverse times as a result of the COVID-19 pandemic. The impact may be greater for veterans who are blind or visually impaired, especially for those with limited transportation options and/or caregiver support. In response, VHA-BRS launched a national initiative for blind rehabilitation specialists to begin contacting veterans with visual impairment. The purpose was to conduct a wellness check on veterans who have previously been served by BRS. VA Secretary Robert Wilkie once stated, "Listening to our veteran patients plays an important role in providing world-class customer service." The purpose of the BRS Wellness Check initiative was and is to ensure that veterans' immediate safety concerns are addressed. Blind Rehabilitation Service provided a touch point to more than 9,100 veterans to ask about their well-being and confirm that they had access to food, medication, and self-care items. VA's personal touch has been greatly valued by Don Overton. Serving as a veterans advocate during the COVID-19 pandemic has been both challenging and rewarding, he said. Challenges such as maintaining organizational operations, member services, and stakeholder engagement has required significant adaptation and effort in providing support for an ever-increasing remote workforce. On a particularly lonely and difficult day in the office, my cell phone rang. I was pleasantly surprised to hear the voice of a member from the VA Eastern Blind Rehabilitation Service team in West Haven, Connecticut, on the line, he recalled. She was calling back to check on my well-being and genuinely cared about my responses, Don continued. The conversation was comforting and reassuring, covering everything from accessing VA care and services to sharing resources for assistance with obtaining supplies and maintaining overall health. BRS Continuum of Care programs are continuing to provide access to vision rehabilitation during these challenging times in alternative formats, including VA Video Connect and third-party alternatives such as FaceTime, Skype, and Facebook Messenger video chat. BRS Continuum of Care providers have provided more than 6,200 clinical Video Connect encounters this fiscal year through May. BRS staff have implemented innovative virtual care practices that include healthy at-home sessions for veterans to reconnect and reinforce healthy habits, relaxation support groups, adaptive chair yoga, traumatic brain injury and low vision support groups, and living well with low vision support groups focusing on wellness and adjustment to vision loss. Our deepest appreciation to BRS staff for being dedicated, compassionate, and proactive, as many of our veterans are scared and overwhelmed. A reassuring voice goes a long way to mitigate those fears.